Hi, I'm Michelle Kenway and welcome to Pelvic Exercises. Today I'm going to teach you some exercise for after hysterectomy. These exercises and techniques will improve your recovery from hysterectomy surgery, and they're really worth practicing before you have your surgery. There's three main exercises we're going to look at today. The first one is deep breathing exercises, the second one is circulation exercises, and the final one will be a technique to help you move in bed. So let's start with the first one, deep breathing exercises. It's really important that you breathe deeply after your surgery. Many women tend to breathe shallowly following a hysterectomy surgery, so this is a technique to actually get the breath right into the base of your lungs. First step is to sit tall. So sit tall with me. Put your hands around the base of your rib cage. Feel that base area there. Now when you breathe deeply, you're breathing through your mouth or through your nose, whatever feels comfortable, I want you to make your rib cage go wide as you breathe in. Let's have a nice big breath in and make that rib cage go wide. Breathe it in and let the air out slowly. Can you feel that you're not using your neck and shoulders? We want the breath to come down here. This is the type of exercise that will help to prevent chest problems after having gynae surgery. So let's go again with that deep breath. Big breath into the rib cage. Breathe it in. Feel your rib cage go wide and relax and let it go. Finally, I want you to try that exercise one more time. As you feel the rib cage go wide, you might notice that your abdomen moves forward just slightly, and this is also a correct part of the exercise. It shows you that you're doing the exercise correctly. So one final time, nice deep breath into your rib cage, sitting nice and tall for starters. Let's breathe it in, big breath in, let the air out slowly, and relax. How did you go? It's worth practicing that before your surgery. The next exercise we're going to do is to help you improve the circulation in your lower limbs. You might have been on a plane flight and had been told to do circulation exercises during that flight. The reason for that is that when you sit still, and particularly after gynae surgery, you can increase your risk of clots forming in the deep veins in your calves. So these are great exercises to do, particularly when you're not moving much when you get home from surgery. So, if you can position yourself in bed, and maybe the way you're going to be after your operation, lying down, and I want you to think about moving your feet up towards your head and feet back down again. So this is called a calf pump exercise, and if I actually move my pants up, you can see my calf muscles contracting. So lifting my feet up, you can see the calf muscles contracting strongly and down. If you push the back of your knees into the bed as you do that, you'll also tense your thigh muscles. And this is a really useful technique for propelling that blood that's in those areas back through to your heart. So up and down, nice and steady as you're resting in bed, in hospital, and then when you return from hospital. And I try and get patients to do those 10 times, with up and down being one, every 15 or 20 minutes while you're awake. Good regular exercise to do. Okay, so we've done the first two exercises. We've done our breathing exercise and our circulation exercise. Let's move to a bridging exercise to help you move more comfortably in bed. So let's say it's following your surgery and you want to move in bed. This is the safe way to move in bed without putting downward pressure on your wound, and it'll also help you to move without pain in that area. The first step is to slide one foot towards your bottom. So slide one heel up towards your bottom and then move the other heel up to your bottom. In that position, you can quite readily lift your bottom off the bed. This doesn't use your tummy muscles, it won't put pressure down through your wound, and it might also relieve some pressure off your back. So that's the exercise, it's called a bridge. So in that position, you can see then you can actually move yourself up the bed, and you could move yourself from side to side. This is a much safer technique than using an overhead bar to pull yourself, which will use your abdominal muscles and push down through your wound. So that's that simple bridge up and down, and it's also very nice and it'll take pressure off your back, because sometimes your back can feel sore after a hysterectomy as well. So a couple of those, up and down and up and down. Okay, great. So what have we done today? We've done some deep breathing exercises, big breath into your rib cage and down to help prevent lung problems. We've also done some circulation exercises with our feet moving up and down to help prevent circulation issues, and I've taught you a really great technique for moving in bed following your surgery. So remember that practice makes perfect. It's really well worth practicing those before your surgery, and here's to having a healthy hysterectomy and a healthy pelvic floor. Bye for now.